A cartoon character unexpectedly begins to hiccup, creating an immediate sense of surprise. The sudden hiccuping serves as an attention-grabbing opening to engage the viewer. The light and engaging tone is established through the character's reaction and the overall animation style. The opening scene is designed to be immediately captivating and entertaining. A hiccup is characterized by the unexpected contraction of the diaphragm. The diaphragm's contraction forces air rapidly into the lungs. The rapid intake of air results in the characteristic hic sound. The diaphragm is a large, dome-shaped muscle located at the base of the chest cavity. Contraction of the diaphragm increases the volume of the chest cavity, facilitating inhalation. The hic sound is produced by the sudden closure of the vocal cords. Vocal cord closure is caused by a sudden intake of air. The rapid closure of the vocal cords is a key component of the hiccup sound. This physiological process explains the origin of the hiccup sound. The vocal cords, or vocal folds, are two bands of smooth muscle tissue found in the larynx. The sudden intake of air causes the vocal cords to abruptly close, producing a distinct sound. Understanding vocal cord mechanics provides insight into the hiccup reflex. Persistent hiccups can cause significant discomfort and frustration. The repetitive, involuntary nature of hiccups contributes to the feeling of annoyance. The lack of control over hiccups can lead to a sense of helplessness and irritation. Various remedies are often sought to alleviate the discomfort and stop the hiccups. The search for a solution highlights the need for effective methods to manage and eliminate hiccups. The persistence of hiccups underscores the importance of understanding their underlying mechanisms. A medical consultation involves seeking professional advice from a healthcare provider. During an examination, a doctor assesses a patient's health through observation and inquiry. Professional medical advice is essential for informed healthcare decisions. Health consultations aim to provide clarity and support for patient well-being. Ruling out serious underlying medical causes is crucial for accurate diagnosis. Nerve irritation can be a potential underlying cause of various symptoms. Stomach problems may also contribute to the patient's overall condition. Excluding serious conditions requires a systematic, diagnostic approach. Comprehensive evaluation helps differentiate between serious and benign ailments. Accurate diagnosis ensures appropriate treatment and improved patient outcomes. Stimulant drinks, such as Sting or Red Bull, may temporarily alleviate hiccups. The potential hiccup-relieving effect is related to the drink's stimulating properties. Stimulant drinks can affect nerve function, potentially interrupting the hiccup reflex arc. Caffeine and other ingredients in these drinks can stimulate the vagus nerve. Moderation is advised when consuming stimulant drinks due to potential side effects. Overconsumption of stimulant drinks can lead to adverse health consequences. Stimulant drinks may help settle hiccups by distracting the nervous system. The stimulant's effect on the nervous system can interrupt the hiccup reflex arc. Stimulants may influence muscle contractions, potentially reducing diaphragm spasms associated with hiccups. The exact mechanism is not fully understood, but involves neurological and muscular interactions. Breathing into a plastic bag is a simple home remedy technique. This technique can be effective in certain situations to help regulate breathing. The process involves inhaling and exhaling, slowly and deeply into the bag. This method helps to increase the carbon dioxide levels in the blood. Elevated carbon dioxide levels can help to reduce symptoms. It is important to use this technique safely and under appropriate guidance. Breathing into a bag increases the concentration of carbon dioxide, CO2, in the inhaled air. Elevated CO2 levels in the inhaled air lead to a corresponding increase of CO2 in the bloodstream. Increased blood CO2 levels can help relax the diaphragm muscle. Relaxation of the diaphragm can effectively stop hiccups. This method provides a physiological mechanism to temporarily alleviate hiccups by modulating CO2 levels. Breathing techniques can effectively subside hiccups. Controlled breathing helps regulate diaphragm movement, alleviating hiccup spasms. The effectiveness of breathing techniques reinforces their role as a remedy for hiccups. Visual confirmation can strengthen the perceived effectiveness of the breathing remedy. Consistent application of the breathing technique leads to a noticeable reduction in hiccup frequency. Persistent hiccups may necessitate medical intervention. Medical professionals assess and address stubborn hiccup cases. Various treatment options exist for intractable hiccups, ranging from medication to nerve stimulation. Understanding the underlying cause is critical for effective hiccup management. Largactil is administered via injection to manage intractable hiccups. The injection delivers medication directly into the bloodstream for rapid absorption. Largactil acts on the central nervous system to suppress the hiccup reflex. The medication's mechanism involves modulating neurotransmitter activity. Effective treatment requires precise dosage and monitoring for potential side effects. Largactil provides relief by interrupting the neurological pathway, causing persistent hiccups. Excluding dangerous underlying causes is a critical first step in patient care. Careful review of a patient's condition helps to identify potential red flags. Administering medication without proper diagnosis can lead to adverse outcomes. Diagnostic tests and assessments are essential for accurate diagnosis and treatment planning. A thorough understanding of a patient's medical history is crucial for informed decision-making. Prioritizing patient safety requires a systematic approach to medical evaluation. Safe and simple remedies for common hiccups are summarized on screen. Viewers are encouraged to try the presented remedies for relief from hiccups. Remedies may include techniques such as breath holding or controlled breathing exercises. Simple physical maneuvers can also be effective in alleviating hiccups. The video concludes with an invitation for viewers to subscribe for regular health tips. Engagement is encouraged through a visual prompt to connect with the channel. Regular updates are highlighted to incentivize ongoing viewership. The outro aims to build a community around health and wellness.